video is made to briefly explain the commonly used instruments in the ENT OPD. The video is made under the guidance of Dr. Tarun Ojha Sir, Professor and Head of the Department, ENT and Head and Neck Surgery at Mahatma Gandhi Medical College and Hospital, Jaipur. To begin with, we have the head mirror and the bull's eye lamp. The bull's eye lamp gives an illumination of about 200 candle power without any image of the filament. It can be tilted, rotated, lowered or raised to focus the light accordingly. The head mirror, it is a concave mirror which has an adjustable headband. The circumference can be adjusted with the piston and the mirror can be adjusted with the pin given here. It is used to focus the light from the bull's eye lamp. The distance between the lamp and the examiner should be about 30 centimeters. The next instrument that we have is the thedicum nasal speculum. It has a U-shaped holding part with curved blunt blades directed at right angles to the U handle. The method of holding the speculum is as follows. The U-shaped holding part is held against the hooked index finger of the non-dominant hand, the blades pointing towards the palm of the hand. The blades are closed by compression between the middle and the ring finger. This is how it is inserted into the nasal cavity of the patient and the blades are released to give a clearer view of the nasal cavity. The use for the speculum are as follows. For diagnostic purposes, it is used to observe the nasal septum, the Little's area, the floor and lateral wall of the nose. Therapeutic purposes include to remove the foreign body, for antral wash and for initial steps of polypectomy, SMR and septoplasty. The next instrument that we have is the Jobson's and Horn's probe and ring curette. One end of the instrument has serrations and the other end has a ring curette. The serrated end on one side is used as a cotton wool swab carrier to clean the oral discharge and to trace sinus tract and for probe test. The ring curette on the other hand is used to remove foreign body, wax and granulation tissue from the ear. The next instrument is a eustachian tube catheter. It is a metallic catheter with a curved proximal end and a ring at its base. The length can vary between 12 to 15 centimeters. It is used to know the patency of the eustachian tube, to inflate the middle ear, to install medications in the middle ear, and to remove foreign body in the nose. The complication of the use is trauma to the eustachian tube catheter, eustachian tube. Additionally, the students should know the other methods to check eustachian tube patency. The next two instruments that we have are oral dressing forceps. The first one here opens completely and has serrated ends. This is how you hold the forceps with the thumb in the first hole and the third finger, that is the ring finger, in the second one. The other one is the micro forceps, which has a smaller proximal end with serrations. The uses for oral dressing forceps are to dress and to introduce medicated packs in the EAC and removal of foreign bodies and crusting from the EAC. The next instrument that we have is an otoscope. It has its own illumination and source of light which is present in the handle of the otoscope. It also provides magnification. The uses of the otoscope is to examine the external auditory canal and the tympanic membrane. It can also be used to examine the ear and nose of infants and bedridden patients. The next instrument that we have is the lax tongue depressor. One end is bent, which is used for holding the depressor, and it supports the little finger of the examiner. The other end depresses the tongue and it is used like a lever to depress the anterior two-thirds of the tongue. It is used to examine the oral cavity and the pharynx. The other uses can be to squeeze the tonsil, to retract the cheek and to test for the gag reflex. The next instrument that we have is a laryngeal mirror. It has a straight shaft and that is how it can be differentiated from a posterior nasal mirror. The laryngeal mirror is available in various sizes ranging from 6 to 30 mm in the diameter. It is used for indirect examination of the oropharynx, the laryngopharynx and the larynx. Students should know the difference between direct and indirect laryngoscopy and the hidden areas of the larynx. The next instrument that we have are postnasal mirrors. They have a bayoneting shaft, and that is how you differentiate it from the straight shaft of the laryngeal mirror. The mirror in the postnasal mirror is smaller than the laryngeal mirror. It is used to examine the nasopharynx and the posterior part of the nasal cavity. Thank you.